Also tonight, fears of a coronavirus outbreak in the United States.
A federal health official warns it's not a matter of if it happens, but when, and we need to prepare now. Good evening, everyone. I'm Jessica Cartalia.
And I'm Yuki Washington. Philadelphia's health commissioner is weighing in on the spread of the virus. Alexandria Hoff is in Center City tonight with how this global outbreak is being handled locally. Alex?
Yuki, Jessica, I do want to begin with this. The U.S. military has just announced that a U.S. soldier based in South Korea has tested positive for the coronavirus. That soldier is now in self-quarantine, and officials are looking into if they had contact with anyone else. Now, meanwhile, here at home, cases of the coronavirus have not spread as they have in other parts of the world. Still, the impact is now being felt by all of us.
For the second day, stocks slid. The S&P 500 closed Tuesday down 3%. This as the CDC provided a warning to the U.S. that an increase in infections is imminent.
I think what the CDC is really trying to tell us is that there's been some unpredictability in the way this is spread throughout the world.
Italy and Iran were dealt overnight surges in the number of confirmed coronavirus infections. The U.S. has been seemingly spared so far with just 53 cases.
We need to be prepared because we don't know how this is going to play out.
You may ask about the coronavirus, which is very well under control in our country.
President Trump has now asked Congress for $2.5 billion to fight the spread of the illness. He could request more if needed, but for now, some say it's not enough.
The administration's approach is disastrously inadequate.
Locally, since the outbreak started in China, air filtering face masks have become increasingly hard to find. Businesses in Philadelphia's Chinatown also reported a decline in customers due to stereotyping and coronavirus fears.
It's important to say that this is not happening right now, and so there's nothing for people to do specifically right now.
Dr. Thomas Farley, Philadelphia's health commissioner, adds the unpredictable nature of this virus and its spread means city officials are gearing up just in case.
We're in conversations with the hospital, for example, so that they can handle what might be an increase in patient flow.
Now, he does add that local businesses might want to consider staffing plans in the event that the coronavirus does reach our area, because that could mean that many employees could be out sick all at once. Reporting live in Center City, Alexandria Hoff, CBS 3 Eyewitness News.
Alex, thank you.